Welcome to another Books and Things with Tom, and that's me. And tonight we're continuing our heroin addiction programs, and this is the 6th in a row, and I am just surprised I managed to get so many people that can talk about it and try to help educate the public. Get your pad and pencil ready, take some notes, and if you see someone that needs help, please help them stay alive. Contact me. I can put you in touch with one of several. Today's guest is Dr. Frank Maletz. Welcome, Doctor.
Thank you, Tom.
Glad to meet you, dear. Dr. Frank is an orthopedic surgeon, a futurist, and systems therapist. And today he's going to talk to us about the brain and what happens when you're in heroin and do a little too much of it, I guess. What does that have to do with orthopedic?
Absolutely nothing.
Good, because I always try to figure it out.
So, orthopedic surgery, of course, is the practice of medicine and surgery that deals with bones, joints. We talked a little bit about your knee, your hip.
Yeah.
Hip replacements would be something that we do. Knee replacements are something that we do. My entire 35-year career in surgery was mainly focused on trauma and back surgery. Those are my two loves. But having said that, as you might expect, that involves pain. And those patients that I took care of, had the pleasure and honor of taking care of, had pain. And so when my surgeries didn't necessarily alleviate or ameliorate all of their pain, I had to do something to help them with their discomfort, what we call nociceptive pain. So it's the kind of pain that comes from a damaged structure in the body. Okay. And when the nociceptors are sending their signals out, both to the spinal cord and to the brain, there's the brain connection. Yeah. All of a sudden, we're now deemed to be, to some degree, experts in pain control. So over my career, I have prescribed medications. And those medications include medications of use, but also medications that can be diverted and abused. And so there's no question that as this pendulum of opioid use and abuse has come into the public domain and is a big topic of conversation, Mayor Passero has taken that on as something that we'd like to correct in New London County. President's speech the other night included that as a big topic of interest nationally.
I was surprised.
So it's on the radar screen.
Yeah.
And I'm here to illustrate a little different approach than my friend and colleague Jim Spellman did on your show last week, which is instead of going to the source of poppy, opium, heroin, morphine, some of the medications I use to treat patients, the morphine derivatives, the opioids, I'm also more concerned, because of my background, in the issue of this thing, which is the final common pathway where those drugs of use and abuse act.
Yeah.
So the brain is the place I believe we need to focus attention, as well as perhaps the poppy fields.
And that's where the high comes in.
That's exactly where the high comes in. That's right.
If you don't realize it up here, you're not going to feel anything.
Correct. Absolutely. So let me teach you something about the brain.
Okay. Because I don't have one, so I really need
well, and as we said earlier, too, it may come, especially to the audience, as a bit bizarre that an orthopedic surgeon who, as I told you earlier, we are thought of as when you're the lowest member of the medical community and medical school, you go into orthopedic surgery because that's glorified carpentry, some think. So maybe I don't have much of a brain either, so we may share that in common, Tom.
Could be.
And again, I am the first caveat I will throw out to the audience is that I am a practicing surgeon physician, but I am not a neuroscientist and I am not a neurologist or a pain management expert. The nice thing about my field, medicine and surgery, is I have access to those people. So in preparation for the show today, I will not present myself as the expert, but I will certainly be willing to present myself as associated with experts. So to make that point clear.
I understand that because that's what I do. So I have to bring people like you in to make me look good.
And vice versa. So there's this little thing sitting on our shoulders that weighs about 3 pounds. It sits in a bony case, and for most of actually my professional career, it has not been amenable to study, because the only way you can study a brain is after somebody dies, and that's not exactly the best way to get functional information, right? So how do we find out how this thing works up there? The nice part of the story is currently we have things called functional MRIs and PET scans, positive emission tomography scans, that allow us to watch brains while they're working. So that's one source of information. The other thing that is very commonly said, and I've been at public meetings where it's said, is that how can you take data from mice and monkey experiments and translate that data directly into human data? Well, it just so happens that this thing we call our brain, and as far as evolution has taken us, it still operates at several very primitive levels, much like those lower animal forms. So when you do experiments on some of the pathways in human brains, they're actually very similar to the survival mechanisms and the reward mechanisms that occur in the lower life forms. So you can actually extract that data experimentally very, very classically and very, very well. So that's how we get a lot of this information. So in that 3 pounds of brain matter, there's 100 billion, let me say that again, 100 billion nerve cells. Whew, a lot of cells.
Wow.
There are 100 trillion, let me say that again, 100 trillion connections between all those brain cells.
Wow.
That's quite a machine.
Yeah. And it works so easy.
Well, you think so.
Well, most of the time.
So the question then becomes, why do we want to mess with something that's so highly evolved? And are we really sure what we're doing when we start adding chemicals to the mix that alter the way the brain works? And it turns out that most of the stuff, when we talk about addictions, and let me run the list for you. This is interesting.
Okay.
And I don't mean to be in any way, shape, or form narrow here. Caffeine, nicotine, marijuana, opiates and opioids, heroin, cocaine, stimulants, LSD, hallucinogens, sex, work, fame, money, gambling, junk food, overeating and gorging, and now we're starting to talk about internet and addictions to that thing we call the cell phone. What do all of those things have in common?
Repetition?
Well, it's even a little more basic than that. There's a system in the brain called the reward system,
Okay.
okay? And that reward system is powerful, but it's also very primitive. So that's the reason why we can study monkeys and mice and still get cogent data referable to human beings.
Yeah.
So that reward system, it turns out, is it's just like survival. It's just like procreation and reproduction of the species. We like rewards. We like things that are novel. We like to learn things. We like to be motivated by things that make us happy.
Absolutely.
All true, right? No one can
absolutely.
disagree with that. And the same thing goes with mice that push food pellet levers and get rewards of juice or a little electric shock to their reward center. So what happens with things like drugs of abuse, or in my case, drugs of very therapeutic use that get overblown, overused, dispersed inappropriately for things they weren't meant to be prescribed for? Well, what happens real simple is those drugs interfere or interface with a system in the brain that secretes dopamine, a chemical. The chemical is one of the neurotransmitters, and it tells us that, to your point earlier, we got high. That was good. We want to hit that button a little more frequently. The problem is that these particular drugs, especially in their incredible potency, because as we have been talking about, when you hit the street drugs, they have been multiplied so much by virtue of combining the heroines and the fentanyls and some of the other more powerful drugs to hook people, to get them to continue to look for that high. What happens is that the word, and I like the word, hijacks the normal mechanisms, the normal brain compensatory mechanisms. And so what happens is that first high is never as good at the same dose. So what happens then? Increase the dose, increase the frequency of taking those meds, and then one very, very important thing happens. And that's the difference between humans and mice and monkeys. We have this other thing called the prefrontal cortex. And that's the thing that says, that's the part of the brain that says, hold on, this isn't good for you. This isn't going the right way. Missing work because you're high, losing your family, just continuing to develop these increasing cravings, these aren't good for you. That gets blunted. So the drugs actually have a negative effect, a potentiating effect on blunting our executive higher level functions. And so the normal brain operating with normal compensatory mechanisms gets changed.
And that's why they keep doing it.
Not only they keep doing it, they have to keep doing it. They're almost, by association, by cues, by the way the brain is actually changed chemically, they don't have a choice. So,
And that's why people say, well, they can just get off drugs, and they can't.
yeah.
And it becomes a sickness.
Yeah, so that's why I wanted to, since you like language and books, so think about that in its full context for a minute. We use terms like doper, pothead, druggie, addict, drug seeker, drunk, hedonist. Those are words applied to human beings with problems.
Yeah.
And they don't get us anywhere. That just doesn't serve any purpose to help them. So in my model and in our efforts to try and help with changing the healthcare system into a real system, which brings in that system theory approach that I've taken and studies that I've done. The answer is we should treat these as patients, neighbors, friends, family, because that's what they are. This is really a disease, and it's been recognized as such by some pretty powerful people, including the head of NIH, who spent her life researching this particular addiction problem. So the answer is, if we can develop, and I'll say that even more positively, when we develop that culture of care and we stop stigmatizing patients with real problems, we can get them into the medical model and actually take some of our really great stuff these days to help them on their way toward rebalancing their brain. And I'm going to be very careful not to use the word cure, because this, and you said it perfectly, this takes a long time to change the brain. It also takes a long time to get it back into homeostasis, into balance.
Wow. It's a shame, because I talked to a guy last night, so I don't feel bad for these gay people. Like, they've got a choice of getting high or not. And I guess you'd kind of like to blame them because they're doing it to themselves. And yet, listening to you talk, it's really not their fault that, well, the first one maybe, but after that it's...
I think that's a great point, because the first one, maybe, right? If folks, we'll go back to the 60s, because I knew the 60s. There was a lot of experimentation with mind-expanding, brain-altering states.
LSD was big.
LSD was big. Magic mushrooms were big. Timothy Leary was big. But that was experimental phases long before we understood the physiology of the brain functioning. We know a lot more now, a lot more data out there. And so, maybe the experimental days are still the insider track for some of these patients. But let's take the case of, say, date rape, or let's take the situation where somebody is just peer pressured into having a big dose of something. That may be a little more innocent. And clearly, I'm here to tell you that it is never the intention of physicians prescribing medications to get people hooked. I mean, that's not our goal. However, as we now understand this brain chemistry a little better from work of neuroscientists, wow, it happens really quickly, because these medications are powerful.
Do you think there might be something out there to offset it?
So I think you're moving me into the treatment realm right now, and the answer is absolutely. So we have mechanisms in place and knowledge to direct detoxification to get people off the meds. When overdoses occur, there are excellent medications now available to stop people from dying.
Narcan.
The Narcan that's available. We also have mechanisms that have been tried and true with respect to support systems to try and get some of the association cues to be derailed, so that as folks detoxify, as patients are surviving their overdoses, they can actually maybe wake up a little bit, have those higher cortical functions kick back in, and they say, wait a minute, I need some support, I need some help, which that goes back to your friend's comment about motivation. They're demotivated while they're on meds, but when we wake them up from an episode, sometimes, and many times, they suddenly, whoa, what am I doing to myself?
Yeah.
And then that's where cognitive behavioral therapies, support groups like Narcotics Anonymous, and communities. Let's go back to communities. When
Yeah.
when everybody realizes that this is a medical disease and a brain disease in the context of some social discontinuities where maybe there's a mental health component, maybe there's a jobless component, maybe there's a homeless component, maybe somebody has self-esteem issues, but we get behind this patient population and help them. Holy smoke, that's a revolution that's ready to start.
Yeah. And there's so many people out there that would like to help and don't know where to go and don't know where to start. And
That's your job, buddy.
that's what we're trying to do, is let people know this is where to go.
Absolutely.
If you know somebody needs some help, contact me. I'll put you in touch with somebody. And watch the shows that are on YouTube, because it's all filled with great information.
I want to just put a little pitch in, and I was given permission to do this. There's a company, and again, to go back to books and things,
Yeah.
the books aren't the only thing that are available these days. There's a company called the Teaching Company, and their job is to find the best teachers in the world to put their courses available and out there. When I had the privilege of hearing from you and Jim Spellman last week that I'd be on the show today,
Yeah.
I surveyed their course availabilities. Professor Tad Polk, P-O-L-K, has a course. It is a couple of years old now, but not dated material at all, called The Addictive Brain. And for those not familiar with the Teaching Company, in addition to the DVDs, which are the actual lectures,
Wow.
there is a guidebook that comes with that, but for an additional small fee, you can get the actual bibliography, database, course material, and the lectures completely,
Oh, wow.
not outlined, but completely disseminated. Dr. Polk is at the University of Michigan, is a neuroscientist in the lab, and I spoke with him after going over the 6 hours of material that is here last weekend, and he gave me permission to recommend this, but more importantly, as I said at the outset, these are the people that are the experts. These are the folks that are helping me to help you get the word out. So that's how an orthopedic surgeon can
We need it all.
do this, right? So again, the Teaching Company has a website, and I would recommend anyone who's interested in being a carer or has, to your point, knows people that are having some trouble, or even the patients themselves. That's a valuable $100 and a great 6 hours a way to spend your time, because you will learn as much as I now know from having spent the 6 hours and talking to Dr. Polk myself.
And what's the other book you brought in?
Well, that's also something that I just finished a course on. This is Fritjof Capra's book with a close colleague of his from Italy, Dr. Pierre Luisi, called The Systems View of Life. And this is a textbook that's available as well as a course that's available. And Dr. Capra is very interested in the biological mechanisms of systems theory. And the reason that I'm so interested in the brain right now is because the brain, if you think about it, is actually a nested ecosystem in the body. We have to eat to keep the glucose going, to keep the brain functioning. So it's part of our whole human body ecosystem, right? But it's also into and unto itself a very, very intricate mechanism. So I think we mess with it at our cost.
You know, it's you talk about the brain and what we can do with the brain, and to screw it up is sickening. It's just I've never taken any drugs and except marijuana, not marijuana, when I was in the hospital, and mainly because I had seizures when I was a kid, and I don't want to lose control of my mind again.
Absolutely.
And
it's nice to be in control of your mind.
Yes, right? It is, because when you lose that control, because I remember with the seizures, you don't know who you are, you don't know anything. And I don't want to do that again, so I never tried any kind of drugs. But I really appreciate you coming in and discuss this with us. And I think, again, if anybody out there has got any questions, anything you want to know, please contact me or contact the doctor, and he's got all the information. He's got more information than I do. And I just listen and I really appreciate it. We've got a couple more minutes. Is there anything else you'd like to add?
Just one comment. We spoke for the best part of the half an hour about how drugs and potent drugs of any kind, for good use or for bad, change the brain. What I hope that I've started the conversation on a community basis with your assistance and the show's kind invitation is that I can help change your mind as to how to see these not addicts, but patients.
And they are patients. And the thing is that once they've done that high, the brain is off to it by itself, and now it's obeying whatever they want.
It's been hijacked. It's off track.
Yeah.
But we can get it back on track, and we can help.
Now, I got 2 minutes left, and I really appreciate you being here. Park Deck VFW is starting their fish and chips every Friday night, starting tomorrow, and that's going to be through Lent until Friday, that's going to be all through Lent on Friday nights until Easter. And you can contact them at 860-599-2404. Don't forget, we have everything on one floor. There's basically no stairs. We do have ramps to get up into the other building, into the hall, and we got plenty of parking, so come on down. For previously aired shows, tune into sec-tv.org and click on the YouTube button and reach the site for Books and Things with Tom, and you'll see all the shows I've done this year, including all the heroin shows in the last 5 weeks. And today's show will be on YouTube probably Monday. And I want to thank you for being here, Frank. It's really a pleasure.
My pleasure.
Great to have you here.
Thank you, sir.
And let's see, I should put my glasses on. Also, please check my Facebook page, Books and Things with Tom, for updates. And tonight's show will be on there as soon as I get a chance. And thank you for watching. Email me at santostom@comcast.net, and be sure to answer you. And winter's not quite over, so it's still nice to cuddle up with a good book on the cold nights. And I'll see you next week. Thank you. Once again, thank you.
Thank you, sir.